Hello, and thank you for watching. This is one of many videos brought to you by Joel Gilchrist, licensed massage therapist, owner of Bodyworks by Joel. You can visit me on www.bodyworksbyjoel.com. Now today we're going to be working with Emma, and we're going to be warming up Emma's upper back, mainly focusing on the trapezius and the rhomboid region. Right now, this is Emma's spine, this is Emma's shoulder blade, and we're just going to be working to lengthen these muscles, taking away a lot of pain and discomfort. And for those massage therapists out there who are very experienced, we are going to be working with the rhomboid, which is another layer deeper than the trapezius, and we don't want to get too confused. It gets very confusing with some of the deeper erector spiny muscles that come up the back. So your pressure is very, very important. So please do not go too deep while you're warming up. So we're going to start with a warm-up. What I like to do is I like to bring my thumbs down, add a little pressure, keeping a little distance between the two, and pushing muscle tissue and connective tissue towards this shoulder blade. What I feel as I just use a with fiber movement, which is going along the fiber, not going across the fiber. Because these fibers in the rhomboids go this direction and the trapezius go this direction, and we're going to be doing both directions diagonally, of course, going with the fiber. We're going to lengthen by doing this movement. Again, keeping that space. Breathing nice and deep. How's the pressure, Emma?
Perfect.
Good? Good. Excellent. Now that was mainly movement for the rhomboid. We're going to do that again. I like to repeat things in threes. I learned in school that 3 is a great rule of thumb, and so far it served me very well. Now, what I'm feeling is I'm feeling the ribs. I'm feeling that lower trapezius, the edge of that muscle that's coming up from the spine here, and that can get confusing because many therapists that I've received massages from have tried to convince me that I have a knot there, unknowing that I'm a massage therapist. They had no clue that I knew that it was just the lower trapezius muscle. A knot is typically, if you've watched the previous videos, typically going to give you some symptoms of pain and discomfort, burning, and numbness, tingling, and sometimes loss of range of motion. So that double thumb movement's a great way to warm up. Then as I begin to repeat it, I will find the edge and just run both thumbs along the edge of this shoulder blade. I'm finding the edge of that shoulder blade, pushing almost at an angle down and out. Okay? And step by step, looking to not miss any tissue. And with this technique, you're also giving your client an opportunity to visualize what you're doing. So your speed should be slow to moderate, pressure should be light to medium. And I'm not sure if you can see there, but there's a lot of red coloring going on with Emma's upper back, so she definitely needed this today. Now if you don't want to use your thumb, you can double finger. Right now I'm just using one finger. It tends to work very well for me, especially on those Fridays or those Saturdays like today. Again, we're just pushing towards. Now as you can see, there's a greater definition into that shoulder blade. Unless the lighting's off, then you probably can't see it, but I can feel that shoulder blade just coming off, relaxing a little bit more, settling into the massage table. That's a huge plus, you know, we're getting some reaction from that muscle. Next, what I'll do is I'm going to run my thumb down the edge of that shoulder blade, and this is really the hot spot. The rhomboid, the trapezius, these muscles come together here and they're going to create strain and stress. And because it's an area that's hard to stretch, hard to just open up, then they're going to, with each layer, create knots. They're going to create connective tissue with the fascia and create scar tissue. That bundling of muscle fiber, that bundling of tendon, that bundling of continuous fibrous tissue, that connective tissue is going to give Emma eventually, if she doesn't exercise or if she just let it settle down, it could possibly give Emma some shoulder injuries. It could set her rotator cuff in a bad position because the shoulder blade, even though it's a floating bone, to a certain extent, it's part of the rotator cuff, not just the upper back and neck. So now we're going across from that first rib all the way down to that lower trapezius. I'm not sure if you can see on camera, but there is some muscle spasms. Muscle spasms are pretty common when it comes to responding to pressure, the trigger points, reacting and causing the muscle to fire off. It's definitely not a good reaction. You don't need muscles to spasm, but it is a good reaction to identify it because that's the sign that there are knots here. Now I'm just going to go up along the lower edge of that trapezius that we talked about earlier. Make sure to breathe in, Emma. There you go. Now I'm going again just deep enough to feel that muscle tissue, to feel that connective tissue, and even push that connective tissue into the erector spinae muscles, and just push and dig and increase circulation to these muscles. There we go.